Hi all, this is Dr. Sarah Winward. I'm a naturopathic doctor and lactation consultant with your Downtown Doula, and I wanted to talk today a little bit about tongue ties. So I want to go over what they are and how they might impact feeding and what you can do about them. So this is my little model of mouth and a tongue. When we're doing an assessment of a baby for feeding assessment, one of the things that we will do is we will lift up their tongue. So we put 2 fingers in their mouth and lift up the tongue. And so you see in a normal tongue, it lifts up really nice and there's like a big space in between the floor of the mouth and the tongue. But with a tongue tie, which in my little model is a little snap, when I go to lift up, there's tissue underneath the tongue that's keeping it tethered to the floor of the mouth. So you can see I can't lift that tongue up anymore. In this little model, the snap is really far forwards on the tongue, so it's quite obvious, but often with more posterior ties, they're harder to see. And so if a tie is like back here, like further back on the tongue, you might not see it just by looking in the baby's mouth. So if you have been told by a practitioner that your baby has a tongue tie, but they did not put 2 fingers in your baby's mouth and lift up their tongue, then you didn't get a full assessment. And so they could still have a more posterior tie. How this might impact nursing. So things to consider, one of the biggest things that can happen with a tongue tie is pain. So if this is the floor of the mouth and this is the tongue, in order to effectively nurse, your baby has to undulate their tongue in a wave motion. And if there's a tie keeping the tongue down, then possibly they're just doing this, right? Where it's just part of the tongue that's moving, and that can be quite painful because it's almost like they're just flicking your nipple with every suck. It can also lead to issues with supply because if they're not able to fully move their tongue, they're not effectively stimulating you with every feed, and so it can be harder to establish your supply in the beginning, or you might feel like you're constantly playing catch up with supply where it was good, but then it kind of went down and then I had to pump some and then it was better and then it kind of went down again. So if you're feeling like either having trouble getting your supply going or that you're kind of playing catch up all the time, both of those can, a tie can contribute to both of those. It can also have an impact on their ability to maintain suction, and often you'll hear clicking. So what can happen with the clicking is if part of the tongue is tethered to the floor of the mouth, then they're trying to use their tongue, and instead of like being able to use it, what they'll do is they pull the floor of the mouth up. And so maybe they'll start off wide, and this can cause pain as well. If they start off wide and then are slipping shallow, and then you kind of have to like move them around again to get them wide and slip shallow, that can be because they're trying to use their tongue and it's dragging the floor of their mouth up. And that can cause a click where they lose suction because their mouth is moving with their tongue because they're tethered together. You can also see that clicking on the bottle as well, or like dribbling milk from the bottle if they're not able to maintain good suction. That can also be because of a tie. So what to do about it? I almost never recommend doing a tongue tie release without some kind of body work and exercises for the baby, because you really want to make sure that you get all of the tension released and the function of the tongue prepped before you do the release. I just find that you just get a much better result from doing that. In terms of where to get tongue tie releases done, you can get those done at either a pediatrician or at a dentist. Usually pediatricians will use scissors to do the procedure and a dentist will use a laser. And you really just want to make sure that wherever you're going to, you are finding someone who is trained in pediatric tongue tie releases specifically for babies, because tongue tie releases at a dentist in older children is not the same as babies, and you really want to make sure that the person who's doing the release has some sort of lactation background. And there's lots of different people across the city, so depending on where you are and your area. If you have any questions about tongue ties or feeding, you're more than welcome to reach out to us, and I hope you're all doing well. Have a good day.